turn then to Niall Dickson, Chief Executive of the membership body, the NHS Confederation. Good morning, Neil.
Good morning.
Do you think what Simon Stevens has asked NHS Trust to do is realistic?
I think it's a big stretch, rather reflecting what Adrian Bull just said. I think it's very uncertain at the moment how quickly people will be able to get up and running. And of course, there's lots of other uncertainties around. So it's not just obviously trying to run COVID and non-COVID services, staff having to wear this PPE equipment, social distancing, all those things inhibit productivity. And some say some services at the moment are around 60%. There's another factor, actually, which is about patient confidence and whether patients will actually come in the numbers that we need them to come, because there are sort of two messages coming from government at the moment. One is the virus is still here, be cautious, stay alert, these are not normal times. At the same time, we're trying to say NHS services are open for business and we need patients with symptoms to come forward. So there's a tension there. So I think all this is a very short window of opportunity, as you've said. Winter is coming. There's a lot of preparation for that has to go on as well. So I don't think we're saying this is impossible. There was consultation with the service before these targets were set. But we are saying don't expect too much. And we want to lower expectations, frankly, among politicians as well as the public about what the NHS can do. It has been turned inside out over the last few months, and now trying to get it back round the other way and at the same time still treat significant numbers of COVID patients, far fewer, but significant numbers, is going to be a real stretch.
Private hospitals are being used to share the load, aren't they? What about the Nightingale hospitals? What are they doing at the moment?
Well, of course, we use the generic term Nightingale hospitals, but they are actually rather different. So the one in London, for example, is quite different from the one in Harrogate and the way what it can do. So I think they'll be used in different ways. So some of them may be used to treat COVID patients, as it were, thereby relieving other parts of the system. Others may be able to provide a range of other services.
I'm wondering, in this window
where
there aren't that many COVID patients, at least compared to what we had, can't they be used to help get the non-COVID services back up and running?
Well, there are two caveats. I mean, we're a huge supporter of what the Nightingales have set out. The first and obvious one is the real problem with the health service over this period has, in the end, not been about numbers of physical beds. It's about staffing and whether you have the staffing in order to provide these services. Now, we have got some extra staff, and we're hoping to be able to retain them during this period. But that itself will be a significant challenge. And then there's the question of what sort of services a Nightingale hospital can do. If essentially it is one that is just for respiratory care, it's like emergency intensive care beds, then that may not be what is needed during this next period, and therefore the degree to which they'll be used will be variable. But again, it's the right thing to do. And it's also the right thing to do, frankly, to keep a lot of this stuff on standby anyway, because the other big question mark hanging over everybody here is, and it's something that every leader at every point in the health service, whether it's mental health or community or hospital, will be concerned about, is, are we going to see another big spike and what effect that would have? And therefore, you've got to be able to reverse back again to the situation that we were in before if we're going to treat those patients effectively as we did the last time.